There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, how are blood pressure and blood volume related? Answer by Taylor Baker. They are related because the circulatory system is a closed pump system. If the force of the pump, i.e., the net output of the heart, remains the same, but we increase the total volume contained in the system, the pressure will increase progressively the more fluid we add to the system. The opposite is also true. If we decrease the amount of fluid in a closed system, the pressure will drop in proportion to the extent of the decreased volume. The only other way to change pressure in a closed system is to change the amount of force applied by the pump, i.e., the heart rate. The human body naturally does this on its own in order to maintain the same rate of perfusion of blood throughout the organs and tissues, more or less. Hence, in a state of hypovolemia, low volume, the heart rate increases to a level constituting sinus tachycardia. The exception comes when something else, such as a drug, biochemical reaction, etc., influences the net force applied by the heart. Answer by Robert P. Candy. High blood pressure is said to be a kind of silent killer, because its symptoms are not easily understood, but silently damage the heart. DACA. High blood pressure is said to be a kind of silent killer, because its symptoms are not easily understood, but it is silently damaging the heart. About 30% of people in England are suffering from high blood pressure, but many people cannot catch this disease first. But when you realize that there is a high chance of heart attack, stroke, kidney failure, and less likely to lose sight of vision. High blood pressure. The heart pressure is the pressure on the veins and arteries during blood circulation, so blood pressure. But when the blood vessel of the heart is tough due to various reasons and the heart becomes weak, blood pressure requires more energy or pressure than the usual normality of heart. This is the high blood pressure. The heart then spreads blood to each organs of the body by applying pressure in this way. This blood pressure is understood by the amount of blood supplied to the heart or how much of the blood vessel blood flow is main. Blood flow depends on narrow or wide blood vessels. If the blood vessel is slower, blood pressure will increase but blood flow will decrease, and blood flow will increase when blood flow is increased. Blood pressure will decrease immediately. Measuring blood pressure. Blood pressure is different in the daytime. Normally exercise, blood pressure is high during walking and there is less blood pressure during sleep. Even human pressure can increase blood pressure. So by measuring the blood pressure in different times, it is known that the correct condition of blood pressure is known. Measurements of blood pressure in two conditions. Systolic condition. Oxygenated blood is spread through the heart through contraction of the heart. Read more. Healthy food to lose weight. Healthy breakfast recipes for weight loss. Bodybuilding workout routines for mass. Fast weight loss diet plan. Lose 5 kilograms in 5 days. Diets for quick weight loss. Answer by Julian Goldman. The great scientist Arthur Guyton published extensively on the complex physiologic relationships that enable our bodies to maintain normal blood pressure and blood volume. If blood volume drops too low, caused by blood loss or dehydration, normal blood pressure values may not be able to be achieved. An early sign is an increases in heart rate. If blood volume is increased, for example by drinking excessive fluids, the body increases urine output. In some people, especially those with hypertension, the blood pressure may rise until they eliminate the excess fluid.